Awesome. Hi, everyone.
Hello.
I think we're waiting for a couple people to join and connect in.
Hello, everyone.
Hi,
Hi, Flaminia.
Good morning, good evening, good afternoon. We never know what time it is where other people are.
Mhm. Gareth is not going to bed early today. Hi, Ramaya.
Good morning.
Good morning.
How are you doing today?
Good, actually. We are getting a little better weather than what we used to have last week. So it's a good news for us. No more minus.
Mhm.
That's good for us too. Glad. Spring and summer are finally coming. Or I guess going to summer now.
Well, I don't want to have the same summer what we had in India. It's unbelievable. It's too much.
I'm sure the humidity.
Good
Yes.
morning, Gareth.
Good morning.
Hi,
Hey,
Gareth.
how are you?
Yeah,
Wrestling with what's left in the
joining us today. Maybe we can wait for a couple more people, begin in the next 2 minutes.
You've been a productive man, Ramaya, recently. Well, not just recently, but
I think you guys, part of it. Don't give me all the credit to me. Did you see the list of the drugs that I sent it to you?
yeah.
Flaminia, your microphone is off.
Yes, it's impressive. You did your homework. So
But the sad thing, Flaminia, they are not available in India.
no, I can imagine.
I have to.
That's terrible.
That's terrible, isn't it?
Yeah, it's just it's
It's
just
outrageous.
so unjust.
Unjust, yes.
We'll have to see what we can do with that list and how
Thank
we can
you.
use it. We'll let you know,
One second.
obviously.
Okay, shall we start, Nida? Yeah.
I think this is a good time to begin.
And Gareth has disappeared.
Okay, well, welcome everyone. It's so nice to see you all again. Thank you for joining us today, especially for those who had some time difference issues. We're really glad you can make it. So I guess we can start with a little recap for last session on people who were not here before. We had a discussion about the creation of networks and designating and coordinating expert centers. For this last workshop, we're going to be finalizing that area of intervention and reviewing it, and then moving on to discuss our last two areas of intervention. And that's going to be supporting multidisciplinary care, guidelines, and care pathways. And the second being raising awareness for rare diseases. So in terms of public health and promotion, public health promotion and prevention. Yes, we can start with our mandate. I know we've seen these slides before, but we made some changes based on our work together so far. As you know, the objective of our working group is to encourage member states to provide that access to the best possible care, diagnosis, access to treatment, and a lot of our goals are based on the UN resolution, which was adopted in December of last year. So notably that one that specifically calls on member states to strengthen healthcare systems in order to provide universal health coverage. And the UN resolution goes so far as to address the adoption of national plans and strategies, as well as the creation of networks, which we've integrated here. So the first notable change that we've made actually to this working statement is that we added an area of intervention on raising awareness for rare diseases. Specifically because through our past conversations, many of you raised really important points about the importance of having like a communication strategy and engaging with society to raise that awareness and get the conversation going in terms of the public health agenda for rare diseases. So the second change that we had made actually was to combine the two areas of intervention on networks. So we had come up with encouraging the creation of networks by designating and coordinating clinics, experts, and highly specialized multidisciplinary centers of expertise. We did this because our last workshop, there was a lot of overlap between two of those areas. So we thought it would fit best like this. Now we have these methodology and timeline. Just to skim it over, we're on track in developing our statement, and we'll be continuing these workshops into the summer to start looking at other regions of the world who also can be sharing their best practices so that we can ensure this representation in our working stream. Today, we're going to be finalizing the fourth and fifth areas of our intervention. And following this workshop, we're going to be presenting all 5 areas at the WHA event on the 24th in Geneva. So after the WHA event, our last few sessions are just going to be focusing on equity and how we can learn from not only the mature systems that we've seen videos on so far, but also those less mature systems which are developing their capacities. And so the next workshop following the May event will be focusing on low and middle income countries and how our work can take into account their healthcare systems. So maybe we can move on to our recap. Just like last call, we took your feedback from our workshop on the creation of networks, and we've identified the following actions. We actually came up with a bunch this time that maybe we can look over on Miro. So I'm going to share my screen and then we can go through them step by step.
Nida, I'm not sure if we have shared the link for Miro. Have you? Maybe we can copy it in the chat.
So for those of you who aren't familiar with Miro, it's just this whiteboard basically where we can post all of our ideas and work collaboratively on it at the same time. If you're not comfortable with using Miro, you can just speak up on Zoom and I'll be writing everything for you. Otherwise, feel free to also add as many post-its as you want. I'm gonna start sharing my screen now. Okay, so here is our identified actions. The first is establishing partnerships with multiple stakeholders in society to develop that shared approach on establishing this integrated multi-system care. And under that, we have a subtopic on, I remember we had discussed that it's important to have one leading national organization, especially based on the best practices we had seen, to coordinate that collaboration between stakeholders and act as a sort of umbrella champion for all rare diseases. The second one we had was identifying priority areas and common goals based on mapping and needs assessment. The third being defining those quality standards for the selection and establishment of the designation process, while also ensuring that patient organizations are part of the process. And then the fourth was actually on data sharing and knowledge generation within these networks. So under these, we have 2 subtopics: connecting rare disease experts and then developing national referral pathways. We ended with, actually this is 6, establishing shared guidelines, standards training, and then the 6th being using digital technology to facilitate this collaboration between different stakeholders. So I'll give you guys a couple minutes to just look at it, digest it, and then we can start talking about how we can add to it, make this better, review it.
Okay, I hope you can recognize some of the ideas you were sharing with us last week. if there's nothing new to say, it's fine. We can move on forward and continue with today's topics.
So it's just engagement of, I guess, local governments and payers. You know, the more supported we are from our, initiation onwards by the various governments, the better chance we have of starting well and continuing well.
Thank you, Gareth.
And the
Hi,
other thing
this
to
is
me,
Claudia.
I think
Yeah,
you're
Claudia?
Yes, just in reading it, for point 3, I'm a bit unclear. So the selection and establishment application designation of what? Of the centers of expertise, or what specifically? I feel like it's missing that point.
Yeah, it is regarding centers of expertise. Thank you for making
Okay,
that
thank
added in.
you.
Let me clarify for Carlos, who's just joining us, that we are reviewing the last discussions we had in our last call. These are like the main points we are bringing to you for validation or modifications.
Hi, hello everyone. Yeah, sorry for the delay. I am the back and forth. I'm sorry, I need to leave at 10 a.m. My time is in 15 minutes. Sorry for that.
Don't worry.
No worries. I think Gareth had also something else to say.
and the other thing is that I'm personally, maybe not challenged by, challenged by, why not, is, what are the best metrics to be measuring yourself against? You've got to have a place to start, idea of what you do and how you're going to measure the impact of what you're doing. And so I'd love, I think one of the key early things is to define a common set of metrics that we're going to be held accountable to. And I think particularly, there's all the standard sorts of metrics that governments might use, but I'm particularly interested in what the prems and proms, the type measures, what are the patient experience and outcome measures. What's the traversal set of that? What's the common set of that cross cuts, many rare diseases? What's almost like the minimum data set for prems and proms? Common data element type approach of prems and proms. It'd be nice to have a list that says, these are the 10 prems and proms that are common across rare diseases, and that should be, key outcome measures for your centers of expertise, whatever that might be, pain reduction or whatever those are. It'd be nice to have. I think it would be important to identify those early, so we can have early measures of success as well. So I think one of the other key things is identifying the early wins and then communicating those. And for early wins, you've got to know what your key outcomes are.
Thank you, Gareth. We also have Claudia.
Yes, just looking at the board, I feel like 3 and 5 are kind of part of the same part of establishing guidelines. And the other one that I think we discussed last time that I don't think that it's quite captured is the part of leveraging the existing infrastructure and expertise that's already in the different systems, and then just again kind of so establish these guidelines, but leveraging what it's already there and sort of encourage what the centers that are already there or the institutions to complete or fulfill these guidelines rather than sort of try to necessarily, it could be possible in some ways, but not necessarily to come up with like new research centers necessarily, but just improve upon what's already there.
Thank you, Claudia. Any more comments? Okay, well, if you are happy with this.
Hello, it's Carlos. It's only one comment related to the 4A, the Connect Rare Disease Expert Center of Expertise. Maybe also there is in the part of this number 6, because the connection between them is using the digital technology, and then the coordination between them. That is the importance in terms of the logistics and support. Then the other one is related to the number 1, when you're talking about designated one leading for national organization, yeah. But also I think that it's important because we try to coordinate in regional and global level. Also, it's important to design who will be the lead in the regional, and then in the global, who will be the lead according to the expertise in the therapeutic area, or discussed previously in the terms of the policy of the care of the patient living with rare diseases. I think that is important also to coordinate in different levels, not only designate one for the national level.
Thank you, Carlos. We will sure translate that to the building of the global network.
I guess before we move on to this topic, the only other question I had for you was, based on your country and your experience in your country, is there anything that we are missing? Anything that would be helpful when you're talking about encouraging the creation of a network in your specific country?
Have we, I mean, I know you said at the beginning of the call, but have we specifically focused, have we specifically put here comms related to encouraging the creation of a network?
Yeah, I mean, would you think that it would be more beneficial to put that in here or under our intervention area on the raising awareness? Because that's more focused on comms as a whole.
Yeah, I just also want, I think probably in both.
Mm-hmm.
Actually, designation, coordination, collaboration. Nah, forget it. Don't put it in here. I was thinking more of initiation.
Mm-hmm.
No, leave it out. Sorry, apologies.
No worries. Thank you. I see that Claudia also has her hand up.
Yeah, just so I know that we discussed this very early on, and so just going back to the part of leveraging what's already there. Like some time ago, we discussed that sometimes the centers of excellence in certain countries, in certain settings, might not have all the things needed under the same roof. So that in some cases, some of these centers of excellence could be formed by partnerships between 2 or 3 perhaps different institutions in the country that maybe have strengths on particular areas, and together can form that. So I don't know if that's necessarily captured somewhere, but I thought it was important to bring that back, because again, if there's already a center that's really good at the clinical part but doesn't have for example, the genomics or the molecular testing part well, and that's an important part of the standards that we're defining, maybe partnership between different institutions, it's a good way to create these centers of excellence with what is already there.
Thank you, Claudia.
That's a great point.
Yeah. We have been trying to include as well the experts that are not associated to a rare disease center, but yeah, partnership should be extended to many institutions as well. So thank you for highlighting it.
Maybe that's our cue to move on, Concha.
Okay.
We can get started on today's discussion.
Dear my colleagues, sorry, Concha and Neda, and I don't know if this has probably already been discussed, but when there are no designation process and no centers, etc., is it already discussed somewhere else? How do we do this? You're on mute, Neda, if you're saying something.
Yeah, sorry, had a technical difficulty, but actually no, it has not been discussed before. This third supporting action is on, I guess, working towards defining the quality standards.
So no, because I'm trying to preempt this very common comment that, okay, in my country, there is not such a thing that can be called centers of expertise. We call it differently. I'm trying to see, how to make sure that what we create here is going to be inclusive of every possible setup. Of course, there are experts everywhere. There are places everywhere. But is there something we can add to make sure that it's fully inclusive of all the different realities on the ground? Because we say it all the time that this is what we want. But I'm wondering, is there maybe in this recommendation the space to put something like, I don't know, making sure that all the, you see what I'm trying to say, Gareth? We had this discussion in the past already, so maybe I don't know the right language and I don't want to impose the right language.
Who's talking?
Gareth.
Oh, we cannot hear well.
Sorry, can you hear me okay now?
Yeah.
I'm trying to, I'm not sure I'm understanding what you're saying. I think I am familiar, so I'm going to tell you what I think you're saying. And in that, it almost, you want a way for centres that aren't quite yet ready to be able to participate to become ready. Is that what you're saying?
Yes, and I'm also saying where there is something that is not not in every country, there is a designation process that is foreseen for centers of expertise. How do we make sure that whatever sub-actions here we are identifying, there is also an action that will integrate what is not yet a center, you see what I mean?
I got it. Yeah, no, so I think I'm thinking of it in two ways, essentially. One is almost like an affiliate, like if you, sometimes with organizations you have like an affiliate membership, but you don't quite qualify for the criteria for full membership. So I'm not suggesting that we have a membership. What I'm suggesting is that you have some sort of category where you don't quite fulfill the criteria of a center of expertise, quote unquote, but you're on your way there. And so you come on in that capacity, and you almost want it to have it as a responsibility of the centers of expertise to help those, one of their core responsibilities or roles is to help those affiliate members, whatever we're going to call them, to become full members. So I don't know, I'm trying to think of structures or ways. That's not the right language. Affiliate members is definitely not the right language, but the concept, I'm just trying to use the concept where often, like say, participating in an EU grant, you might not meet all the criteria as in some sort of external entity. So you come on as an affiliate member, and then come over time. Sometimes you see sometimes with the EU grants, eventually a country almost gets recognised as being able to become a full partner in those grants. A bit like what's happened with Canada with some of the rare disease grants over the last 5 or 8 years, for instance. So yeah, that's my thoughts.
Okay, would this be okay for other people? Yeah, Loredana, don't worry. Yeah. Okay, so this kind of middle way in progress kind of participation.
In progress, exactly, in progress.
Okay, thank you.
Great. I've taken note of that, Gareth and Flaminia, and we'll implement that into these actions as well.
And also, specifically the point about full members having an obligation, if you like, or having as part of their, to become a center of expertise. One of your criteria is that you must support, centers in progress of expertise, whatever they're going to be called, in some way to advance.
Okay. Can you see my screen? Okay, today working plan is to move to area of intervention 1, raising awareness for rare disease related to public health promotion and prevention. As Nida was saying, this came this idea came from the previous discussions we had. And we are also going to talk about area of intervention 4, which is multidisciplinary care, development of guidelines and care pathways. So if we go to the first video we have from Michelle, let me go and share her video, Michelle Vadier in Europe. Indeed, I'm having trouble sharing my screen. I'm sorry.
No worries. I can go ahead and share it, actually.
Thank you. So we are going to see these 2 videos, and then we will have a discussion on them.
Yep. So as Concha mentioned, this is from Michelle. She's going to be talking about learning from the clinical patient management system in order to ensure that equitable access to diagnosis, treatment, and care. And she works for Eurogen, so she'll be specifically covering that as well.
My name is Michelle Batty, and I am the Programme Manager of the European Reference Network called Eurogen, which deals with rare urogenital diseases and complex conditions. Next slide, please. I have no conflict of interest. Next slide, please. I'm here to describe an example of the European reference networks to show you how we use a system called the Clinical Patient Management System to hold virtual consultations. We really use it to bring experts in rare diseases together virtually so that they can have clinical discussions about the most rare and most complex cases. It's a digital tool for these new e-consultations, and it's compatible with computers, tablets, and smartphones. There is a completely secure upload of the patient's medical information, and then there's an exchange of pseudonymized patient data. So all after the patient has given his or her informed consent to share their data. And CPMS users, they're all healthcare professionals who work in one of our healthcare provider centre members. And really the system now means that the information, the medical information, can travel rather than the patient. It's the advice which is being given from the network experts to the doctor treating the patient wherever the patient happens to live. Next slide, please. So we know that because rare diseases are so fragmented, there are cases scattered all over Europe and indeed the world. We know that some of them can't be diagnosed at national level. There simply aren't enough experts. So they can now be referred to the appropriate ERN. And the ERNs are really a system which sits above the national member states' healthcare systems and enable countries to access highly specialised advice where they don't have it in their country, perhaps because they have a very small population. The ERNs use CPMS to evaluate the cases and provide the highly specialised medical advice back to the clinician who's treating the patient at national level. And that's where all legal responsibility for the patient still remains, as it's always done, with the clinician treating the patient where they live. Next slide, please. There's full involvement of the patient. The European Commission very helpfully helped us produce an informed consent for the patients for use across all the ERNs. And the consent form can also consent patients if they want to be part of research projects, and also for their data to be included in the 24 ERN registries. The outcome of the cross-border virtual case discussion is usually discussed with the patient by the clinician treating them. Next slide, please. So what's been achieved? Well, since they began in 2017, the ERNs have considered more than 2,000 cases. And now a fantastic result is that we have 2,500 experts registered in the ERN system. CPMS is being constantly improved to make these virtual consultations easier, faster, and more convenient for the experts using them. Next slide, please. And this is just a slide to show you that most of the panels that have been created by our particular ERN were a success. So advice was sent about the patient, the particular rare disease or complex case. Next slide, please. We have identified some challenges with the completely new system that operates across all countries in Europe. Expert discussions are best done by video meetings so that they can look at the scans, the medical information, and discuss it. It's often very difficult to get the experts together, though, at the same time. So we really do rely on a huge amount of goodwill from them, and they often do this late in the evening after they've finished all their clinical work. Some experts struggle a bit with the technology, but they manage to overcome this by having trainees in their department who are prepared to do this for them. That's really nice to see. And it can be difficult for clinicians to get used to how the new system works. So by making it easier to use, we hope to increase uptake in the future. Next slide, please. So most ERNs provide as much support as they can to their clinicians using CPMS. We do this on a one-to-one basis. We provide specially tailored manuals with hopefully clear instructions on how to do things. We have video tutorials, and there's also a newsletter that we produce to tell people tips and tricks and how the system's changing. Next slide, please. And we're really excited because after the enlargement of the ERNs, most ERNs are doubling in size. So there's an increasing number of experts available to join in the virtual MDTs. The simplification of the system is coming, and we hope that that will make it more user-friendly. And there's an exciting pilot reimbursement. The Commission is allowing the reference networks to reimburse healthcare providers small amounts for some of the time that their experts spend giving this expert advice. And that's a really welcome new development. And new software to make the whole system work better is under development. Next slide, please. And it's been really interesting to see this new tool that the Commissioner's put at the disposal of the ERNs, which is we're really just beginning to get to grips with. We've managed to reuse it in the light of other circumstances. So, for example, CPMS was used in the COVID crisis, for example, when doctors in other countries needed to talk to other doctors about how they were treating the COVID patients, particularly in the early days where very little was known. We're also using the CPMS system again to try and advertise that we have all our doctors and experts are available to give advice to doctors in the Ukraine about patients with rare diseases. And we're also very much trying to support all the border hospitals, all the members of our network in Poland and other countries who are really dealing with the cold face of all these patients, refugees arriving, some of whom have rare diseases. The cancer networks in particular have been very active, and they've managed to arrange the transfer of at least 400 paediatric patients with cancer out of the Ukraine and shared out across the healthcare providers, some of them in the network who can take on the care of those children who very desperately need specialist attention. So it's really nice to see the way CPMS has been used for different purposes very quickly to respond to challenges that none of us could have thought about 10 years ago, or even 5 years ago. So I think, again, that's a really interesting evidence of how the ERN system is able to directly help patients, other healthcare professionals, and really make a difference across Europe. Next slide, please. And that's the end of my presentation. Please, if anyone is interested in the ERNs, feel free to contact any of them via their websites.
Okay, thank you, Nida. And now we are moving on to the second video, which is from Dr. Emma Palmer from Australia, and it's about multidisciplinary care, setting up a rare disease education, awareness, and training programs.
Thanks, Katja. I'm just putting on the screen share.
We cannot hear it, Nida.
Sorry, that's my bad.
So
could you hear
thank you very much.
Yeah.
Thanks.
The opportunity of telling you all about a project that we're running in Australia, which is funded by the Australian Government, Department of Health, and is in response to Australia's National Strategic Action Plan for Rare Disease. And the project's called Rarest, or Rare Disease Awareness, Education, Support and Training. And it covers the whole of Australia. It's a national program for 3 years. But first of all, I'd like to acknowledge that I'm presenting today on the lands of the Gadigal people of the Eora Nation. And I'd like to pay my respects to the past, present and future traditional custodians and elders of this nation, and the continuation of spiritual and educational practices of Aboriginal and Torres Strait Islander peoples. So Australia launched its National Strategic Action Plan for Rare Disease in 2020. And there were 3 main pillars: awareness and education, care and support, and research and data. Rarest tries to respond to some of the main action points from the action plan. So firstly, that we recognise that workforce and systems need to respond to the current and future needs of those living with rare disease, that increased awareness and education is a vital first step. So this is important to empower people living with rare diseases to become active participants in their rare disease journey. And that improved awareness is anticipated to have many flow-on effects, in particular reducing isolation, which is often such a core feature of rare diseases, and delays in diagnosis and treatment. And also recognising what an amazing job rare disease organisations do in raising awareness and providing person-centred information, but that they are often under-resourced. So we have a team of of both researchers, but also clinicians, evaluation experts, clinical education experts who are part of the team from across Australia, from different universities, but all.
Sorry about the speed, it was a bit
The
fast.
team includes.
I think we can slow it down a bit. Thanks for telling me, Flaminia.
The umbrella group for rare diseases in Australia, Rare Voices Australia. So it's actually a partnership between this advocacy organisation and universities and clinicians. It's divided into 3 streams. The first stream's focus is trying to improve awareness and resources about the mental health and well-being of people living with rare disease. And when I say people living with rare disease, that's not just people that are affected by a rare disease, but also their carers, their families. And that stream is being led by Rare Voices Australia, and will focus on finding the best quality resources to help support rare disease organisations understand when people in their communities may be developing mental health and wellbeing concerns, but also digital resources to help support people to minimise the risk of mental health conditions in people living with rare disease. The second stream is about upskilling clinicians, so healthcare workers across Australia, and really doing that in a way that is a partnership with the clinicians. So understanding what their learning needs are and then responding to those in a range of different ways. We'll have some national guidelines that will come about from the project, which will highlight what are the key steps and issues that need to be covered in rare disease care. And we'll have a blended platform of an e-learning platform that will be available long-term, which is an adaptation of the Rare Disease 101 platform that Medics for Rare Disease developed in the UK. But also we will set up, in collaboration with Project ECHO, a community of learning practice called Rare Project ECHO. And the third stream is about capacity building in the rare disease sector. And that will be designing a range of advocacy and multi-stakeholder co-design courses, masterclasses, education and mentoring. This is a quote that our rarest program manager highlighted for me, which I think is beautiful. When in doubt, ask the experts, those with lived experience and those whose voices have not been heard. So across all 3 streams, we have consumer and multi-stakeholder engagement so that everything we do is informed and developed in partnership with people living with rare disease. And also that everything we do is rigorously evaluated, because this is a pilot and we want to be able to show at the end of it what's worked, where we think that the future direction should be. And hopefully that will be lessons that will be useful for the whole global community with rare disease. So stream 1, as I mentioned, is really focusing on, first of all, looking to see what resources are already out there to support the mental health and well-being of people living with rare disease. And then where there are gaps identified, co-developing resources to fill those gaps, particularly digital resources to help when a person is living with a rare disease, that they don't feel that the possibility of mental health impacts is a stigma, but instead to break that down and let them know that looking after themselves is actually a really important thing and should be first and center, and something that we can help enable. Stream 2, as I mentioned, is really focused on trying to help doctors not feel overwhelmed that there are 7,000 rare diseases. How can they know about every one of them? But more some approaches to good rare disease practice and signposting excellent resources as well. So as I mentioned, we're partnering with Medics for Rare Disease, which has led a very successful e-learning platform for clinicians in the UK, and adapting that to be specific to the Australian context. And we're also very excited to be setting up a rare disease project, ECHO, and this is a clinical community of learning practice. And the idea is that we're bringing in doctors and healthcare professionals from around Australia to talk together, to share challenges that they're finding in providing excellent care to people living with rare disease, and together come up with answers and solutions that are sustainable. And the third stream is really about whole of system change. So how can we think about what needs to be changed at policy level, and also how can we help support those vital rare disease organizations to do the amazing work that they do in the most effective manner. An amazing slide that Lauren put together, who's our evaluation officer, but just to really emphasize that everything we do, we want to be evidence-based and coming out with some learning points that we can share with the global community. So that's it in a summary. It's really trying to build awareness, education, with particular focuses on mental health and well-being and clinician education. And I'd welcome any questions that people may have as my contact details and that of Nada, our amazing program manager.
Awesome.
Thank you, Nida. We can go back to, oh, well, let me share first my screen as we can have a look at the ideas and actions that were suggested by you and by the panel of experts during the survey we sent regarding this area of intervention. So we are going to see those multidisciplinary teams is one of the ideas, the core basis of this multidisciplinary care. Develop a patient-centered approach. Also evaluate the specialist training needs that are needed to coordinate this holistic approach. Promoting development and implementation of clinical guidelines, and establish national care pathways. So we can see those in Miro, and we invite you, as we did in previous sessions, to either go to Miro and write whatever you want, or you can stay here, raise your hand and comment on everything, or highlight new things that hasn't been suggested yet. Okay, we have the Miro board here. I think you have all access to the link that Nida have shared with you, but I'm going to share it again, just in case some of you arrived a bit later. This is the invitation to go to the board.
Thanks, Concha.
You're welcome, Nida. Okay, who's going to be first?
We can also pull from the videos. Personally, I thought it was very interesting that Michelle mentioned how the CPMS helped those in Ukraine and also people during the COVID crisis.
Mm-hmm.
I see Claudia has her hand raised.
Yes, just well, it sort of mentions it in the last sticker, but I think it would be good to emphasize that in addition to clinical care guidelines, it would be very important to establish guidelines and even minimum requirements for diagnostics for patients with rare diseases, so that I mean, there's a path of to, like, if you have a rare disease patient, what are the necessary tests to run, and again, try to guarantee or encourage as much as possible access to genomic and molecular testing, not just like clinical or other tests, but definitely do genetic testing.
Thank you, Claudia. Building on what you just said, I would like to remind that when we're talking about multidisciplinary and multi-systemic approach, we mean not only variety of doctors and interventions, but also holistic care, including other types of medicines like homeopathic or acupuncture, and also integrated care like social needs, employment. So it's to look at the whole needs of the patient. So if you had to develop some guidelines to include this, what would be the steps you would follow?
I was thinking, to pick up on your point, what's missing here is the promotion of cross-sector integration. So exactly as you're saying, how to support integration with disability insurance, employment, education. It's not really mentioned here. That's a critical focus.
Mm-hmm.
The other thing I was thinking about, reflecting on one of the acknowledged limitations of the CPMS, is how do you facilitate asynchronous assessments? So for CPMS, or you'll have to be online at the same time. How do you facilitate asynchronous input from different clinicians?
Thank you, Gareth. I was checking if there's anyone here from Europe, but I think
no. So the points are there is asynchronous rather than synchronized. So
yeah, but as I don't know,
because currently the video systems are synchronous. You need to be on. Yeah.
Okay, we will raise that concern. Oh, Alison probably knows about it. Thank you, Alison.
Yeah, this might be somewhere I might be able to help a little bit. So I don't, as I'm non-medical, I don't have direct access of use of CPMS, but working with the clinicians in Europe, I know a lot of the opportunities and challenges they found with the system. And when cases are presented, actually, the case study and the backing information on the individual patient to be discussed are uploaded beforehand by the main doctor presenting the case. So they might present various test results, various treatment history, they present the problem of that particular patient case, and that's on the platform to be commented on by anyone that's invited to the actual case discussion, which will be at a set date in the future. And that's when you get the asynchronous call that everybody actually is who's online for the actual case discussion. But there's ample opportunity before that case discussion, and as I understand it, afterwards potentially for any invited participants to comment and provide input to that case outside of the meeting, which is perhaps even more beneficial when you're talking international expertise as opposed to even within Europe with a couple of hours time difference. I hope that helps a little.
Thank you so much. I take this opportunity for doing something that I should have done before, and is introducing Alison Watson to all of you, that she's a new member of the Collaborative Global Network. So we are delighted to have her. She's got experience, as you just saw, with the year end. So we believe she's going to be a great asset. But if you wish to introduce yourself, Alison, we can dedicate a few minutes to that.
Okay, thank you, Concha. So I'll be incredibly brief because my history and background is not as important as the great work you're doing here. But I just joined last week as part of the team, and I'm going to be helping with the project management of the Collaborative Global Network, helping with the planning and the monitoring and reporting and governance around the fantastic work that the team are doing. But as Concha mentioned, my background is both as I'm the co-lead for the patient advocacy group for Epicare, which is the Rare and Complex Epilepsies European Reference Network, as one of the 24 ERNs. And I've been involved in that for the last 5 years. So I have sort of first-hand experience of things that are working well and the good practices that I'm seeing there, but also some of the things where we can improve, and there's always areas for improvement. I have a son with a rare disease, so I have a background there, but I also have a background professionally in business analysis and project management for over 20 years. So I hope I can bring both my professional skills and personal and volunteer experience with rare diseases to this group and the extended working groups. And I look forward to meeting lots of people in Geneva in a couple of weeks' time.
Yeah. Thank you, Alison. We're looking forward to meet you in person too. So, okay, while we were presenting Alison, there has been a new addition, a new comment from Claudia that Nida just.
Yep, it's on leveraging national, regional, and international rare disease networks to provide patients with that access to care, diagnosis, and treatment.
Thank you. So feel free to keep on adding your thoughts on these.
Just dropped a couple in the chat rather than they can just sort of be cut and pasted across. Sorry, if you feel that that's easier.
Yep, I'm adding that here, building rare disease capacities amongst nursing staff as well, and that focus on integrated care and cross-sector.
Maybe just let me ask something else to move the conversation. Like, for example, what are the steps that you could start right now doing in your country related to this raising awareness for rare disease with the resources you already have available? What would you be able to do, or what are you already doing?
So sorry, Concha, you're talking about now moving on to awareness raising?
Yeah.
Yeah.
Sorry, I think I moved the conversation further, right?
Yeah. Yes.
Sorry. No,
Maybe,
sorry.
yes.
That was my mistake. I wasn't intending to do so. No, I wanted to continue on this, and I wanted to ask you about what would you do with the multidisciplinary to develop multidisciplinary rare disease pathways?
And maybe we can also talk about exploiting digital technology for this as well, as we also saw in the video, and how you have used digital technology, or how you can in your countries to support this care and the guidelines. See some comments in the chat.
Yes, we have from Alison. She's suggesting that maybe to add education awareness raising among holistic resources such as social care, educational, and workplaces of rare diseases, even less awareness of rare diseases as a concept that than in medical sectors. Yeah. Edmund Lim also is suggesting, adding to Claudia's point and linking to the CPGs, that should countries consider adopting international consensus statement of care as a starting default? Over time, it can be localized and adapted.
Does anyone want to answer that or touch on that point?
Hi, Nida. Edmund here. If I could just add to that, I guess coming from Malaysia, unless there's a local clinical practice guideline, a lot of clinicians assume there's none, which tends to be very frustrating, because for many rare conditions, there's always some country or some group of doctors who have already made headway. But rather than adopting it, there's always the need to sort of wait until there's a local version, which means there's a massive gap. So I'm just thinking, is it possible as a global community for us to start to promote some of this work that's already, worked on by some country somewhere, using those things as default first? Otherwise, we're always waiting to develop a local CPG. And until that's done, everyone assumes there's none, right? So patients have to try to use the international ones, try to get it localized, and there's nothing to help, families actually do that. But if there's some sort of guidance, say, you go with that first, or unless it sort of really cannot fit a local context, that at least we've got a way that maybe across the world we can lift up and have some sort of standards in place at the start, rather than assume there's none.
And a complementary approach to that one is a bit like what happens is increasingly happen in the drug regulatory space, where essentially a number of companies now will say, if it's been approved by the EMA or the FDA, then we're going to say it's 80% of the way to getting approved in the the respective country, and instead of going through a full process, we just there's a couple of tweaks towards the end of the assessment process. So if there's a way that essentially countries can essentially can officially adopt, okay, this has been accredited through the ERNs. The ERNs said this is a good model of practice, and so rather than saying we have to completely rebuild it for the existing environment, it's just like we're going to accept the large majority of this, and there's just a couple of tweaks that we need to make. So some sort of hybrid approach.
Yeah. Thank you, Gareth. Edmund is adding to your comment that adopt, then adapt. So yes. Thank you, Edmund.
Carlos also has his hand raised. I think you also made a point.
Yes,
Carlos, about transitioning. Would you like to expand on that?
Yes, and sorry, maybe that's my last intervention in oral, but I tried to send anything in the chat because I had the other conference too. Yes, okay. Two things. The first one is, yes, it's important to adopt the international guidelines because we assume that is the complete management of care of the specific disease or a specific therapeutic area. However, also as Gareth mentioned, that is important if the country or the region have harmonization in the guidelines or harmonization in the regulatory point of view. Otherwise, it's only good in the paper, but it's really hard to get the final implementation. For the reason I think that is maybe important the previous step, as I mentioned before, that is the commitment of the local governments, and especially the understand of the Ministry of Health and Regulatory Agency, the importance to treat the patient with living with rare diseases. For the reason to promote the multidisciplinary team, in addition to have a multidisciplinary team in the networking, is important also to include the representatives of the government in this table in order to understand, for example, these guidelines, the national and the rationale of the guidelines and treatment of.
Great.
Thank you, Carlos.
Carlos, I think you're muted again. You cut off.
Yes, can you hear me now?
Yeah, we can hear you.
Yeah, yes, and then the other point, I hope that you hear me about the transition and the inclusion of in the table of the government in order to understand what is the rationale behind the adoption of these guidelines. And then the other point is the transition. If we're talking about holistic, it's important to talking about the transition between the childhood to adults. That is the more, I think that is one of the pillars and the more critical steps in the life of the patient living with rare diseases. Because many times we have a center of excellence that is pediatric per se, but when we go to the adults, we don't have this transition, and it's a broad distortion between the pediatric and adults. That is important also to include in holistic registry. And then send everything from to the chat. Thank you so much, and sorry for that.
Thank you, Carlos. We know you have to leave today early, but we're going to leave the board open until tomorrow or the day after. So feel free to come back if you wish to add any comments. Okay, do we have any more suggestions here?
I mean, we can also ask best practices in your own countries if you have any best practices along these lines to share that you've already started or that you are an initiative that you're starting. Okay, well, then I guess maybe we can move on to the next area of intervention.
Oh, look, Gareth has just posted something that they are developing a cross-sector model of care at our rare care center at Perth Children's Hospital.
Do you want to talk more about that, Gareth?
Yeah, so we're in the process of establishing a clinical centre of expertise for rare and undiagnosed diseases, and we're taking a sort of a value add and cross-sector approach. So the way that we're establishing is to add value to existing things and not to duplicate any resources, and to have very much an outward-facing model. And what I mean by an outward-facing model is, as well as doing the standard, not standard, but as well as employing within the health sector, so doctors, nurses, allied health, we're also employing directly in other sectors. So we're employing in education, we're employing in disability sector, we're employing in mental health, we're employing. So the idea being that way we'll have true partnerships with the sectors, and we'll have opportunities to not just navigate people to services, but also for them to have soft landing spots and kind of open arms. And also, as we are implementing our centre, we have several levels of advisory, and one of the sort of peak levels of the local advisory has directors of various sectors on that advisory. So we have the director of disability and the director of the education department, and et cetera, et cetera. But actually part of that sort of what we call a program control group. And as I said, we're directly employing people in those sectors. So I guess that's what I mean by a cross-sector model. And we also have the way we're thinking about how we accept patients will be in 3 tiers. And so the first, the top tier, the most intensive tier is you kind of need everything. You need everything coordinated across health as well as all the other, and integrated across all the other sectors. And then it's kind of almost like a shopping list of things that we will provide or link to. And so the lowest level of support is you might just need one intervention. So you're actually, your care is being really well coordinated, but education's your big issue. So that, you tick that box will help with the education side of things. And then there's a kind of a tier 2 level, you might need, sort of 2, 3 or 4 interventions. So cross sector and very much outward facing, and then kind of like a needs-based delivery model to supplement other things that are going on. So for instance, in our state, there are excellent services for cystic fibrosis. So we're not going to provide those services. We're not going to duplicate what's already been done, unless someone in the cystic fibrosis community is identified as saying, well, actually, there's one thing on your shopping list of services you provide that we would benefit from. Again, say it was a better disability access plan or whatever. So that's how we're sort of implementing our model of care.
Thank you, Gareth. Okay, I think we are moving on to the next topic.
Yeah, I think we've got a great amount of Post-its on our board. So thank you for your contributions here. And we'll come back to you at the next workshop with finalized recommendations for here. Okay, moving on to our last area of intervention to cover. This is a new one. And I think it linked a bit with Emma's video as well on that awareness, education, and training. She mentioned that they're doing as part of the Verist program. So we have a few just post-it notes jotted down here. It wasn't included in our survey for the panel of experts, but came up with a few ideas based on our conversations with our working group and I guess throughout this work stream. So feel free to take a look and let us know what we should add, what works in your country, what doesn't.
Are you currently doing anything related to raising awareness? What is it working? What is not working?
Is there something around sort of debunking rare disease? Because it can be a very confusing sort of topic for different stakeholders. And the reason why I raised it was in April last month, our own Ministry of Health in Malaysia issued on their website, on their social media, a definition for rare disease. And they had rare disease is due to basically enzyme issues. And the whole post and a video was all centered on that, which was really confusing because they made rare disease actually just become one thing, right? And this is our Ministry of Health. So what it needed was all the different patient groups had to voice out. Some of us had to post on their social media posts and say, take it down, please. This is so misleading. And I think it's happened before with other stakeholders because it's hard for people to understand.
Thanks, Edmund. We added that.
Sorry, Nida.
I just see Claudia has her hand raised.
So with this area of intervention of raising awareness, that include education as well? Because I think, part of raising awareness, especially for the early diagnosis, the early identification, and that includes also educating the public, educating primary care physicians to recognize that a complex disorder might be a rare disease instead of how to channel those patients through the appropriate specialists, geneticists, tests, care centers, etc. And then also educating officials, government officials. Also, and well, that one might be a separate posted, but sort of engaging with government officials to educate and raise awareness to promote changes in public health policy.
Thank you, Claudia. Well, Claudia was was speaking. Gareth was sharing with us two links that I will share. Well, you have it all here, but I take this opportunity to let you know that the Teams group is already set up, and we will be sharing in the next few days all the information regarding the videos that have been shown in our calls, plus the recordings of the calls, plus all the resources that have been shared, like those that Gareth has shared with us just now. Carlos is adding to Claudia's comment that it's a good point, and he adds to educate the schools for early signs and symptoms for rare pediatric diseases. Thank you, Carlos.
And Allison had also added to Carlos's point about the lack of basic registration, and without this, how can we know the scale of the rare disease problem or reach out to those, which is an important point I'll add to here. Samuel, I see your hands also raised.
Yes, hi, good afternoon. And yeah, I wanted to highlight also the role of the media in the awareness creation and education efforts. I think we need to also pay attention to that and how we could utilize the media to help promote awareness and draw the attention of the policymakers and everyone to know how vital they need to pay attention to rare diseases, and patient groups and patient organizations can also utilize that to share their story. And when we talk about the media, we're talking both of the mainstream and the social media as well. And so as a tool to drive the awareness and education efforts.
Thank you, Samuel. Have you got any experience on that? Are you doing anything about that in Africa, maybe, or in Ghana?
Yes, it's been usually during the Rare Disease Day, we use the media a lot to spread awareness on rare diseases. But aside that, we are implementing a media awareness campaign where one of the media people who got the benefit to be trained in as part of the workshop done by the American press is now actively involved in helping to promote awareness through the media. And so recently he had a session on one of the primetime news to talk about rare disease, where he did a short story to help promote awareness, which a lot of people listen to. And so we believe those efforts could be utilized and highlighted in many cases. We see a lot of interest when we approach the media and when they give us a slot to talk about rare diseases, and we see a lot of people come on board. And so we believe it is a good tool for public awareness that could be used. And more especially if we don't use the media and give them the right content they tend to sometimes in their own way bring some level of sensationalism. And in our parts too, we also use the media a lot to debunk stigma and help to reduce the stigma around rare diseases. And so that could be very, very useful.
Thank you. Thank you so much, Samuel, for sharing that. We also have Claudia that would like to speak, and then Laura.
Yes, just to that point about media, and that I think it would be important to keep to make efforts to sustain that communication throughout the year. I mean, February is pretty sort of intense, and there's a lot of attention on rare diseases because of Rare Disease Day, and media gets very interested, and there are interviews on that. But then once February 28th passes, it's sort of kind of people forget, move on into other things, and then there's no continuous communication and these raising awareness effort. I mean, we still do it, many of us, but there's that lack of media attention that February generally has. So I think finding ways to engaging with media to continue these efforts throughout the year are really important to sort of keep the topic at the top of the minds of people.
Thank you. Thank you, Claudia. Laura? Laura is a colleague of RDI. I don't know if you know her, but she's working in our communications department.
Yes, hello everyone. I will try to put my camera on, but if my connection is not so good, I will switch it off. I'm sorry for that. Very nice to meet you. It was really interesting, Samuel and Claudia. I totally agree with you. Like we have a lot of communication around February for the Rare Disease Day, but not so much after. And we work with some media, like for example, Rare Revolution magazine. And the main issue that was highlighted was that the journalists didn't really know how to talk about rare disease, and that they were willing to have like a sort of wording guideline that they could use, what to say, what to not say, how to talk about rare disease vs disabilities, because you all know it's not the same. People who suffer from rare disease don't often have a disability or anyway. And so they don't really know how to navigate in this subject, and like what point they could focus on the article. I really think that a wording guideline would be a real good idea to build like in the collaborative global network, for instance.
Thank you so much, Laura. Great insight to take into consideration. Gareth, I think, would like to speak.
I bombarded the chat line with a bunch of different things. I thought I might just talk through them briefly individually. So one thing we did to raise rare disease, it's still active, and it looks like we're going to reactivate it in Australia and China, and now expand it to Brazil. There's a thing called The Suspense is Killing Me, which is something we use to raise awareness around being undiagnosed, and where we got comedians to tell jokes but withhold the punchline, and then they say, "Is the suspense killing you?" And then they, then they deliver the punchline, and the suspense of not having a diagnosis, and the angst that creates. And so we got famous comedians to do this, and then we got children living with rare disease to do it, and then we created a way to crowdsource it, where you could basically then tag in people to tell a joke, so you can spread it through your kind of friends. So that's The Suspense is Killing Me. That was one thing. Another thing that's been very useful is medical students and/or other students to help raise awareness for rare diseases. Again, we're doing that locally, but the exemplar of that is what was Students for Rare Diseases and now is Medics for Rare Diseases in England. So they've been very increasingly influential. The other thing I put is educate the middle management layer of health executives. So to some degree, we have success with clinicians and success with very senior executives, but it's that middle management layer of executives in the health system which are harder to get at, but are actually kind of helpful to actually get things going on the ground. So how to actually target that layer of the hospital executive, I think, is also something around a comms piece. Around the education piece, we started something that driven by a youth with rare disease who was distressed at the lack of support she was getting in the education system, and so wrote to the health minister and the education minister to ask for something to be done about it. And so we started this thing called MeduRare, which is about better connecting the health and education systems around rare diseases and educating educators to be aware of rare disease and what to do. Someone else mentioned education. Another thing that we did to sort of pick up on the point about having ongoing things is we had a weekly release through social media, where we took the UN Convention of the Rights of the Child, and then we looked for rare disease correlates of that. So we took each right each of the rights under the UN rights of the child, and then said, what's the correlate for that in the rare disease situation? And so each week we released another one of these over a year, because there's about 50 odd of them. And again, that was a medical student and a lawyer and the peak advocacy group got together and did that. So it was just when someone said, that it's really good to have sort of repeat messaging or messaging that builds on itself, because it's as you say, just having events around Rare Disease Day really critically important, but what's the ongoing momentum around the messaging?
Thank you, Gareth. You make me think about one case that I saw last week in Lisbon. One alliance in Portugal was approaching their Ministry of Health in order to ask for permission to do some actions for awareness with the schools, and they managed to get it. So they are approaching different schools and talking about rare diseases, and then the children need to feedback on what they've learned. They feedback on their parents, and then they send the survey to the parents to check what they have learned and what the parents receive from the action. Yeah, and I know Eurordis is going to work with them in order to expand the idea, and it was supported by some drawings, kind of comic kind of thing. So it was really, really interesting.
Yes. Concha, can you put me in contact? Can you put me in contact with those people? Because I'd love to link what we're doing with what they're doing.
Yeah, sure.
That'd be really great. And Edmund, I've put the links to all those resources and articles in the chat. So, did I put the one about the? So if you look in the chat, Edmund, the one that says released in weekly installments, there's a link to the free full text article there, or you can just send me your email address and I'll email it to you.
Okay, we have Samuel that would like to talk. Please go ahead, Samuel.
I was just adding up to the school initiatives, and it's for us, it's been phenomenal, because sometimes you approach someone to talk to them about rare disease and they're already told, oh, so my child has been talking about rare diseases in their schools and their school campaigns, and so you are the guys behind that. And so we see that working with the school children too has been very, very instrumental, especially when we look at our school event this year, where we had so many schools participate, and how the event and the kind of activities they even went through, and how they were so excited about it. We think that the students may have even many creative ways of sending the message to everyone, and that can be really, really explored. And so I just wanted to add up to that. It's really a great tool to target the young ones as well, and even opportunity, especially to those in tertiary, to be able to mentor those in the primary and the high, even in the junior level, about rare diseases. So how we're trying to do it is that those in medical school can learn from those practicing, and then they can then transfer the knowledge to those in the junior high school. And that kind of a model too can be very useful.
Thank you so much, Samuel. Who do we have here? No more hands. We have a comment from Carlos. He would like the inclusion of the academia and push to include rare diseases in the syllabus for medical students and any healthcare providing students. In Brazil, one example is how the caregivers or patients go to the medical faculties to explain about the disease, for example. Thank you, Carlos. Another idea from Gareth, partner with UNICEF. Do you say that? UNICEF? How do you call it?
Yeah, UNICEF. I particularly wrote that. I particularly wrote that for the Brazilian colleague on the line, because we started discussions with UNICEF in Brazil around rare diseases through the Brazilian Society of Pediatrics. And they're certainly showing some degree of interest. So I didn't know for that, whoever, if that was a Brazilian colleague online, if they wanted to sort of reach out to Brazil and UNICEF, or I could tell them who we've been talking to.
Okay, yeah, that up. That would be great. Thank you. Edmund is adding that he did a talk in one of the schools in Malaysia, and it was surprised by the profound questions they ask. They have ended up being a multi-year donor with the students voting to support the cause over time. Would you like to elaborate on that, Edmund, and expand it?
Yeah, so one of the schools, they support Genes for Genes globally. So they were looking for a local counterpart, but there was really none in Malaysia. So they reached out to me and then some other parents. So we went in to give a talk. And initially we were a bit concerned because it was junior school. So these were kids from 6 to I think 11 or 12. We thought, okay, we really have to simplify what we talk about. But you'd be surprised, we didn't have to. We ended up having to go really deep into many of the topics. You'd be surprised how the kids at that age can ask really profound questions. And they ended up staying after the talk, catching up with, a couple of us parents and asking what life was like, asking about, our kids, how they went to school. But it was very touching because they asked questions, I think, which was a lot sharper than what adults would typically ask, because, they are just very curious. And ended up over time, right, the school has adopted us. So I think now it's like 3rd year running. Because the students are saying, no, we want to support this cause, right? Because
that's great.
It's different, it's not like just the typical run of the mill, I guess, other causes. So.
Mm-hmm. I'm just thinking from the top of my head that, do you remember in our last call, I think it was the last one, when we see a video from Brazil, from Roberto Giuliani. Thank you, Nida. And he was teaming up even with the football team of the country in order to raise awareness. So I guess there's no limit here.
I was just picking up on Edmund's point. We partnered with Rotary, one of the local Rotary clubs, to create a thing called School Students for Rare Diseases. So we took the English model around medical students and created a little sort of resource kit for school students, and then went and had meetings and discussions at various schools around rare diseases. And we did that with one of the members of the national hockey team. And so then the national grass hockey field hockey team, the Hockey Roos, came on as like an ambassador for rare diseases. Mm-hmm. Their line was, helping tackle rare diseases, because obviously you tackle in hockey. And so I actually think there's a very good opportunity for partnering with sort of global sports. So the biggest global sport obviously would be football, would be soccer, to tackle rare diseases essentially. But you could have multiple sporting codes that tackle rare diseases, because you tackle in hockey, you tackle in soccer, you tackle in American football, and gridiron, you tackle in rugby, and the global nature of rare diseases, lends itself to partnering with global sports. So I actually think that those sporting partnerships are actually very powerful.
Thank you, Gareth.
What additional institutions would you say that it would be helpful to partner with?
Before we move on to your question, Nida, Loredana would like to talk.
Hi everyone. Is the international conference still active? The ICODE conference?
Sorry, Loredana, we cannot hear you very well.
Can you hear me?
Yes, we do hear you much better.
Okay, is the ICORD, International Conference on Rare Disease, still active? You know this conference?
No.
Okay, well, they used to have
Yeah.
a conference every 2 years, but it was in between 2000 and 2010, and then it was organized turn by turn in different places, but I don't know if it's still ongoing. And
It is.
it is.
It's now if you look up ERCAL, 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 you'll find it. Their current focus is
ICORD.
Yeah, ICORD. If you look up, if you put in ERCAL and then ICORD, it'll come up. And their current focus is on Latin America and the Caribbean.
Okay. So, well, in order to raise awareness, it's also to do conference like the European Conference on Rare Disease, but at international level, and organizing that kind of events in the different WHO region. Can you hear me?
Yeah, we can hear you. We're adding it here. We have a post-it on facilitating the organization.
Okay.
National and international conference.
Yeah, I mean, to extend the ECRD, so the European Conference on Rare Disease, I mean, the same kind of organization, because the patients are very well involved in the ICRD.
With patient organizations as well.
Yeah. In ECRD, they are very well involved. They're part of it because it's organized by Eurobis.
Mm-hmm. Oh, okay.
The other thing is, I see we've worked with Rotary. Edmund's worked with Rotary in his country. The Hong Kong's Rotary community is pretty active around rare diseases. I wonder if there could be more of a sort of a multi-country international push into Rotary for a partnership, because it sounds like a number of people are partnering with different Rotary clubs around rare diseases in different parts of the world. But if we could all come together, those people that are doing that, so if Edmund and myself and the people in Hong Kong and whoever else has approached Rotary all sort of come together and said to approach Rotary International en masse, that might be useful.
Yeah, Gareth. It's like adopt RD like they've done for polio. That would be so powerful.
Exactly. Yeah.
Great, thank you, Gareth.
There is a note from Edmund in the chat that he have found that medical students clubs get quite engaged. And one of our webinars, over 100 show up from just one university club. But the change for them is the challenge for them is that busy schedules with the studies, but maybe we should think about planting the seeds to care for rare disease with them. Thank you, Edmund.
I guess before we end our conversation, maybe I'll just ask one more time, any other best practices you'd like to share from your country or anything we can add to this? We're slowly establishing some 4 big ideas and then supporting actions underneath. So public awareness and communication strategy, and education and engagement strategy with medical students, middle management layer, physicians, debunking rare diseases, engaging with government officials, establishing it as a public health priority, and then also social media and raising it not just national but international awareness.
Okay, if you, then let's rephrase the question. If you had to ask for support, what would help you? What are the things that you would need in order to start raising awareness?
To be the most efficient, it could be something has to be done at national level. So in Switzerland, we are really pushing hard the health authorities to launch a national campaign on rare disease. And so we really need the support of health government. We have a national campaign.
Thank you, Loredana. Support from authorities in order to launch a national campaign?
National campaigns, because we keep communicating and trying to raise awareness, but at small levels. I mean, and it takes time because when you inform people by small groups, but you really need a big campaign. Either, okay, we have the Rare Disease Day, but something with the campaigns and television and ad and these official posters and things really at national level in the streets.
Thank you, Loredana.
Alison, please go ahead.
Yeah, I was going to suggest, and I guess that builds on what Loredana's just said, you know, the common branding. And I know we all have the RDI branding, but it's, you know, all coming together maybe and using a very common branding, a common messaging. If you want to move mountains internationally, globally, you really all got to be singing from the same song sheet, and just having that common brand for a campaign could be very powerful, I think.
Thank you, Alison. I think that's a great point. And it was one of this, I can hear echo, hold on. Yeah, that even if each organization or each country are using their logos, if they have like something in common, it's more powerful. You're right.
And it goes along with Lara's comment as well about using that correct and common vocabulary, separating rare diseases from different areas as well.
Okay. If you don't have more comments, we don't want to push it until the last minute. As I said before, this is going to be open for at least until tomorrow or the day after. And we will start sharing all the materials from our previous calls in the Teams folder we created for this group. So you're welcome to share things in there as well.
Yeah, and you're also welcome to reach out to one another. I know Gareth and Edmund, you said you check in with one another. Teams is just this common space where if you found a great best practice from someone else mentioned here, it's a space where you can engage with them. Great. So maybe we can just have a little wrap up and we can end our meeting a couple minutes early.
Yeah, thank you very much to all for coming. It was nice to see you again. Another push very quickly before going to the WHA. So thank you for your ideas. And next call will be with a bit more timing. So
yeah, next call is going to be after our May event. And I think it's important because this first couple of calls, we saw a lot of great examples from initiatives that were more developed and what's already been done and what's successful. And I think for the remaining calls, we're going to try and ensure that inclusivity of, other healthcare systems, and also show you best practices from up and coming initiatives. So we're looking forward to that. And just thank you for your contributions today. We really appreciate it.
Okay, thank you. See you soon. Bye-bye.
Have a great day.